Hey everybody, I am Carlos Spiranelli Ramos, and this is the last part of our management of dental emergencies in times of COVID-19 pandemic infection. In this last segment of our presentation, let's talk about the endo emergency visit itself and how to be protect and perform as fast as possible to prevent overexposure to the potential infected patient. I think that it's past time to finish the discussion about using or not rubber dam. It is more than proven with a lot of evidence that rubber dam is mandatory to keep the field not contaminated by saliva and obviously to prevent leakage of chemicals that we use during the endo treatment to the patient's mouth. It is a standard of care in endodontics. In this COVID infection, we recommend isolation to minimize splatter generation. But we have to remember there is a technique to put a rubber dam. This, for example, is wrong. Place the rubber dam properly so you have to cover the nose of the patient. That is the technique. In this case here, you not only have the nose uncovered, but you have partially the mouth is uncovered as well. Just look the base of the frame here. So the base of the frame needs to go to the mental labial sulcus here to stabilize the whole isolation, but more than that, to give space to do the nose covering as well. This is correct. As you can see, the base is here in the mental labial sulcus. So you have the nose covered and you have fully control of the air formation. Look, this is a study from Portugal published in 2008. Before and after the treatment, they count the number of MOs in the aerosol. You can see a reduction of more than 40% on the log of MOs with the use of rubber dam and rings. Another interesting study showing that chlorhexidine is not the best mouth rinse in regarding of aerosol contamination. In Dr. Hargreaves' paper, it is recommended povidone as a pre-procedure mouth rinse. I remember back in my dental college time that the trauma and surgery department smelled povidone. So mouth rinse with 0.2% povidone iodine might reduce the load of COVID in saliva. Again, will minimize, will reduce, something that studies needs to be performed to show that with the COVID-19. Another alternative would be the use of 0.51% hydrogen peroxide mouth rinse. Vital pulp therapy can reduce the treatment time, and that will keep the risk of infection low. Even though I'm not a big fan of speed in regarding of endo treatment, this will be not a single visit to finish the root canal, but to deal with the dental pain. So in this particular situation, the right diagnosis and a planned and controlled first emergency visit can be done without unnecessary exposure. For vital pulp therapy, the correct diagnosis is fundamental. Make sure that the case is a vital pulp therapy indication, meaning reversible or irreversible pulpitis. By comparing a normal response with the response you get from the suspect tooth using the eyes test, you have the chance, among other signs and symptoms, to plan if it is a case of a pulp capping or a pulpotomy or even a pulpectomy. Always be prepared to perform a pulpectomy, even if the test shows another level of inflammation. I've seen many times in my life as an endodontist false positive and false negative tests. After caries lesion removal, let's evaluate the depth of the cavity and its relation with the pulp chamber. X-ray and CBTC should help before you take action, but the final assessment will be made after the prep. In cases of minor exposure, just covers with MTA and fill with composite or RMGI. And irreversible pulpitis cause uncontrolled bleeding. So keep in mind that this is not the situation that you use calcium hydroxide or even MTA. That is the case of going forward with pulpectomy, actually. Be fast, use a good amount of irrigation, mainly sodium hypochlorite. Try to remove the bulk of inflamed tissue with instrumentation. I recommend the use of rotary files, mainly orifice shapers, since they have high taper and will be more efficient in removing bulk tissue. Remember that everything from the beginning needs to be done under isolation for the reasons that we already discussed. One, your handpiece water aerosol doesn't touch saliva, and two, keep the chemicals of your irrigation without leaking inside patient's mouth. It is very important that you remove all caries lesion and the pulp chamber ceiling without the risk of pulp chamber floor perforation. So I prefer to use the conical safe end burr. It is called EndoZ, moving laterally without the risk of cutting at the tip. Actually, this type of burr can safely touch the pulp chamber floor without a risk of perforation. But again, make sure that the rubber dam is in place without any leakage. You can use light curve flowable composite to seal around the crown, or of course there are different specific products to be used to seal the crown after the rubber dam in place. By removing the caries lesion and having expulsion of the pulp, you have to cut this pulp as in a pulpotomy. If you can control the bleeding using a sterile cotton ball and pressure, for example, then you can proceed covering the pulp chamber floor with MTA or a calcium silicate base liner. Because we are talking about emergencies, this will be a temporary treatment. When the patient comes back, a new evaluation of the case needs to be done. American Association of Endodontists, they don't recognize pulpotomies in permanent teeth as a permanent procedure. But studies shows that high rates of success on this type of treatment. Anyways, in this particular situation of emergencies, we can do it and posteriorly evaluate. Medication pre and post treatment is anti-inflammatory and analgesics, meaning ibuprofen, acetaminophen. This is the medication probably that you're going to use in these situations. Just remember to do a follow-up by calling the patient a phone call as a follow-up, let's say 24 hours after, 48 hours after, a week after. Patients will remember this special care, especially during these difficult times, and will be forever grateful with the attention given. Thanks for attending this presentation. Please send me your questions, comments. My email is carlos.ramos@medidenta.com. You can see all the products that we talk in our website, www.medidenta.com. Thank you and be safe.